Hello and welcome to India Speak, the Center for Policy Research's podcast. I'm Yamini Aiyar, and joining me today is Anurag Behar, the CEO of the Azim Premji Foundation. Anurag has been traveling through rural India as the second wave surged, documenting the impact of the second wave on rural lives and rural livelihoods. On this series, Anurag will talk to us about what he saw, what he experienced, and what he thinks both in terms of the consequences of the pandemic in rural India and what we should be doing in advance, preparing for the third wave to prevent the horrors that have unfolded repeating themselves. Anurag, let's start by asking you to just walk us through your experiences over the last 2 months. I know in the conversations you and I had separately, you had said that almost as soon as the second wave began its surge, you left Bangalore and began your travels around the country. So just over to you to tell us what you saw, heard, the conversations you had, the experiences you had, to give our listeners a sense of what really is happening in India.
Thank you, Yamini. It's the kind of an opportunity that is important that we can share what we've seen on the ground in very many of those kind of places which which you said is there's no spotlight on, since the spotlight is mostly on the metros of the big cities. So sometime towards the second week of April, I was let me just say I was out on a usual field visit, and by then that we were entering a second wave was sort of quite clear. But honestly, I had not absorbed it. I had not absorbed the scale of the crisis. And I was in a particular district, and I went to, as I do, I went to a village. And by then I had learned from last year's experience and this year's experience that if you go to a place and you meet a community, you don't ask them how many people have COVID. You don't ask them how many people died of COVID. You ask them something different. And if you ask them how many people in this village have fever and cough and cold, how many people are feeling unwell? That's the question you ask. And then the other question that you ask is, if you take the past couple of weeks, how many people have died? Why have they died? Emphatically qualify that I'm not looking only for the COVID stuff. Just tell me a response to these two questions. And the reason I learned to ask those questions in that manner is because the reality is that in the places that I'm talking about, these villages, and this particular village is in a distant tribal district somewhere, there is no testing. There's no identification of COVID. And in fact, we have stigmatized COVID so much over the past year that even if people have COVID or suspect that they have COVID, they would rather not admit it. So when you ask the question in this very non-threatening manner, then you'll get responses. And that particular day, I got responses that were just shocking. It was a village of, if I recollect, 370 people. And 140 of them had cough, cold, fever. There had been no testing, so there was no certainty that that was COVID. And in the previous 2 weeks, 3 people had died. And so when I asked how did they die, they said it was pneumonia. So I asked them that, is this the sort of history that we have in this part of the country, that in the middle of April you will have so many people having cough, cold, and people dying of pneumonia? They said no. So I asked them, is this COVID? They said, well, we don't know. We don't think we are touched by it. We have anyway not tested. There's no testing facility available here. But that's the way it is. And that week I moved from village to village. And what I saw, what I heard was just staggering. Absolutely staggering. And the numbers were more or less the same kind of infection rates, the same kind of mortality. And horrifying stories, tragic stories of how people people's breath just goes off. They just give up, and that's it. So in Hindi, as they were telling me, कि बस सांस टूट जाती है इसलिए मर जाते हैं. This is 5 days I spent there in that particular area, and this is village after village after village. And I also saw a fairly clear pattern, which is that villages which are relatively close to the bigger cities, you had greater infection rate in that part of the country. And villages that were distant, and when I say distant, I mean about 150, 170 kilometers away, you had relatively less infection. That particular district that I was talking about, the collector, and I would, what I did in all my visits over the past 10, 11 odd weeks is I have gone and met community people inside the villages. I have met the frontline workers, which is the ASHA workers, the self-help group workers, of course, the auxiliary nurse midwives, the entire health system, the panchayat people, the local teachers. So as representative, a set of people that I could meet, I have met. And a part of that also has been meeting the relatively higher level officials. So in every district, I've tried to meet the collector, the district health officer, and so on. So in that particular place, I met the collector, a young man, extremely competent and incredibly dedicated. He's a person who had not been home for 15 days. He sort of settled down in what is called the local circuit house, because that was the nature of crisis he was dealing with. He was working, and since my colleagues worked there with him, he was 3 hours a day for 15 days, not gone home. And he was completely honest. And his basic point was, look, this is what I have. This is the public health and private health infrastructure that we have. This is the best we can do right now, right? And I am telling you, even on mortality numbers, I am telling you, the system doesn't capture it. So if he told me, today I have recorded 8 deaths, and I know that this must be off by a factor of 8 to 10, right? It's just that I don't record it. So that was, I think second week of April. And then I came back home to Bangalore, and then I decided that, look, I will go out every week, and perhaps through the, Saturday, Sunday as well, just go out every week and go and see this on the ground as to what's going on. And it is very hard to find words to describe what I saw. I've been calling it a near apocalypse, and it was like that. It truly was like that. I don't know what else to call it, because it's the same scene that I saw repeated again and again and again and again and again, right? So when I read the numbers that are now coming out on the mortality, on that excess death data, it is completely unsurprising. Completely unsurprising.
So in some senses, let's just stay with the excess death story for a moment here, because there's a larger political narrative, and then there's also the reality of a state that has not invested in basic infrastructure for building human capital, and health and education are prime examples of that, confronted with an unprecedented crisis. From your story of what the collector tells you, beyond the politics, there's also a very real challenge of documenting death. Was that something that you experienced in the different places that you went to?
Yes, Yamini. Yes. By now, in these weeks, I've been through 9 states. In 7 of those states, I have not felt even the slightest systematic, motivated set of actions to downplay the numbers or not record the numbers.
Right.
So it's just that we have such a system, right? And when I say a motivated set of actions, this kind of stuff that we read about, that a death is recorded and the death had a comorbidity and had COVID-19, and it gets classified against that comorbidity. That kind of stuff, or any other kind of, concerted set of actions to downplay the mortality numbers. In 7 of those states, I did not see them. It is just that our systems are what they are. They would at best capture deaths, and that too with lag, right? and the cause of the death is not recorded in the best of times, right? It's I would say unreal for us to start believing that there could be
Expect otherwise. No, absolutely. But tell me, you talked about the fact that people were falling sick, and there was no real way of identifying whether or not this was COVID, except from a more detailed discussion with people in terms of the kind of symptoms that they were experiencing. You also referred to the stigmatization problem, and we just put out a podcast today, in fact, the day that we are recording, with Dr. Abhijit Chaudhary, who's been working in rural West Bengal, and he too was speaking about the fear and stigma associated with COVID. And I wanted to understand this a little bit more, because I think very often, and it's coming up already in the public discourse around vaccination and quote unquote vaccine hesitancy, where fear and stigma is treated as either something that emerges out of ignorance, or it is something that is part and parcel of rural life, and the only way to resolve it is through a form of state coercion. And I don't know that we fully understand what the roots of this fear and stigma are, but also both more generally, but also specifically as far as COVID is concerned. What did you pick up and understand of this? What are the causes of this fear and stigma? Where have they come from, and why do they prevail? Why does it prevail so strongly in people's minds? And mind you, my own sense is that this isn't even this is not really a rural phenomenon. In my own household in Delhi, when all of us came down with COVID, somebody who helps me out with my children, poor thing, thanks to us, she too got caught in the web. And her big challenge was that she was worried if the landlord in her house where she lives finds out that they have COVID, then it'll cause all sorts of problems for them. And so she, despite being extremely sick, would keep coming back to my home for all the tests, etc., that we were organizing for her treatment. So it's very prevalent across all parts of India. Where is this coming from?
I actually think it's the reverse of, if one believes that this kind of fear and stigma is coming because people do not have knowledge or do not have understanding or are misinformed. I think it's actually the exact reverse. I think it's because they have knowledge, because they're well informed, and because they understand they have fear and stigma. And there are a few specific things regarding COVID-19. One is that in the way we have treated this entire situation, we've thought of this as a law and order problem.
Exactly. Yeah.
Right. So it's like saying, it's almost akin to saying that, oh, we are having riots here, and therefore let's put down a curfew and a section 144. Right. So if you treat something as a law and order problem, and where your essential route to making people change their behavior is a punitive course of action, it ranges from using lathis to fines to putting people actually in a lockup, right? Breaking their property. Then that tells you that they're well informed, right? So one is this general framework, the general mindset that we have of treating this as a law and order, the prevention being treated as a law and order problem, remarkably, right?
Yeah. No, and in fact, this was so prevalent last year in the first lockdown phase. From the stigmatizing communities in Delhi, we had that the Tablighi Jamaat incident as one of many examples. In UP, there was images of a district collector ordering spraying of migrant workers who had come back home, probably after days of walking on foot, given the circumstances then. The framing of the lockdown, and as just in terms of just the word that that we use, we called it lockdown, and the police was out, and it was very much seen, you're absolutely right, as a law and order problem, and people had to be coerced into behaving.
So, and second specifically, let's get into one specific matter, and this one specific matter is in the way then we treated what was called quarantine and isolation. So you get tested, and you test positive, or you're not tested positive but you're waiting for the result, and then you're sent into a quarantine or an isolation center, which first of all is in horrible condition, and you're completely cut off, absolutely cut off from everything around you. You have no social support, you have no contact with your family. Your family and your friends and your community is in the dark as to what's happening to you. Uh, so the way we have handled the matter of quarantine and isolation, again in the framework of law and order, as though you're being imprisoned, versus with a humane, caring approach. And because you talked about that this kind of stuff is not at all just a rural phenomena, it's true in the cities. And I don't want to take the name of the city, but I sitting in Bangalore, I've got, let's say, 4 times calls from friends from somewhere that, can you locate my mother, whom we are not able to find out? And this is a big city I'm talking about, because she was taken to this place and we can't find her, and this goes on for 48 hours. So now when you think of it from a perspective of a village community, or from a community of migrant labor workers who are in a city like Bangalore, and essentially you're tested and you're taken away, right? That's the idea. You're just taken away, and that too by the police very often, right? What does it tell you? That specifically has caused a fair bit of the stigmatization and the fear. And actually, there's a contra-example to that. So I have seen places, and I can't say a state, but parts of states, parts of districts, where this has been treated with much more care, much more humanely, and there it is. Actually, the fear and the stigmatization is almost nil. And in some of these places, what they've essentially done is that they've used let's say the local school, which has been shut now for a year and 3 months, that as an isolation center, where even the food is provided by the local community. Right now, that's a altogether different matter. So the general framework of law and order, this being a law and order product instead of being a public health issue, and then in the ways we have mishandled some of the specifics, right? And you and I don't need to sort of theorize about this particular matter, because you can see the very wide variation in the responses of our health system, our state systems. Somewhere it has worked wonderfully well, and too many places it's just completely fallen apart.
No, absolutely. I think in so many ways, this also brings up a fundamental challenge to public health more broadly. As you were sort of talking about the law and order problem, I had on my mind a question which you answered actually before I could ask it to you, which was, is it even viable for a leviathan, as is the Indian bureaucracy, known to operate mostly on patronage networks, to actually reinvent itself and be compassionate in the context of a crisis? And I think, as you sort of spoke briefly about states where or places even within a state where you saw differences of behavior. And I wondered if you could talk a little bit more about this, because just in terms of, giving our listeners a deeper sense, what does it mean to anchor public health dialogues and public health issues within the community? And how does one think about public health, even where you're basically it is imposing restrictions on freedom of movement on people, as it has done across the globe with COVID, but done so perhaps with a little greater sensitivity and a greater sense of justice. So could you talk about the experiences where you said you saw differences of approaches? Just give us a more granular understanding of what those differences in approaches were.
Let me talk about a particular state and then another state. Let's say the state one. I meet some of let's say the top officials at the state capital, and their general demeanor and disposition is that this is all really tragic and very bad, but what can we do? Right? this is the way it is. We've underinvested in the public health system for decades, and what can we do? And then you can see that disposition reflected in the lack of planning. And let's assume we all of us know that we've underinvested in a public health system for the past few decades. That's true. But everybody's starting at more or less the same kind of data. So you have a state where the decision is, what can we do? And that reflects in the lack of planning. So over the past 12 weeks, let's say, lack of planning meaning, all right, even if you were caught by surprise on the matter of oxygen, now have you geared up? Now are you thinking, where are you getting the oxygen from? How are you going to distribute it? Where will you store it? Are the endpoints having all the kinds of final delivery facilities? Are those actually cylinders? Are they PSA plants? Are the manifolds in the hospitals there? Do you have masks? Do you have HFNCs? Do you have ventilators? Whatever, right? So let's assume for a minute that nothing at the baseline. Both states said nothing, but if with that disposition, there's little or no planning at all, right? And it's shocking. Absolutely shocking. I mean, caught in a once in a century pandemic, and you still don't have planning, right? And once you have no planning, where will you have execution? So in that particular state, I could see everything has just completely, I was going to use the phrase fallen apart, but that's an inaccurate phrase because it was never together. So what will fall apart? However, in that very same state, I go to a district, and you have this, wonderful young woman who's a collector of a district, and she is like going at it on her own. So the state has abandoned her, in truth, right? The state has abandoned her in truth, but she is doing everything she can, and she's, working her informal networks, whether at the with high officials at the state capital or her friends in business from her college days. And what is she doing? She's doing the planning and the resource gathering that the state should have been doing, but she's doing it. That's dependent on this particular woman. And you come down now to the level of a panchayat, and in the panchayat you can see the same variation. That you have panchayats where people have got together and said, look, we will defeat, and defeat is not a word one should use in this context, but defeat this stuff, right? And then you have a situation where in the same state, everything, and mostly everything, is not together because there is a lack of direction from the let me just call it the top right now, right? And the reason I started from where I did is the fact is you're in a crisis situation. You cannot say that let 1,000 flowers bloom and let people figure out how they do it. So you got to figure out a way by which you're aligning all the resources of the state, of whatever unit of the state that you're looking at, plan and execute, right? And in this particular state, there's a lack of direction from the very top. And I can contrast it with another state, which, by the way, is actually on all developmental indicators much worse off than the first state. And there I meet the same set of officials, and they say, look, we understand. We are short-staffed in doctors. We are like this, we are like this, we are like this. This is our plan. And that school thing that I talked about, that is their plan. That, we don't have stuff, but we have a school, right? What will we do? We actually go down to the lowest level of governance, and we say at the village panchayat level, we have formed a committee, and the committee is the primary school teachers, the pradhans, the ASHA workers, and the NM workers. And they will do this. And we will make sure that there's a nodal officer whose support from the block level, every panchayat, and they're assigned, right? And such wonderful planning. I'll give you an example. I mean, it's such impressive planning. That particular state is, its villages, the primary source of water for the villages are ponds, small ponds. A village may have 1 pond, 2 pond, whatever, right? So they've thought through this level of detail, saying, look, the moment you are detecting an infected person, in fact, by the way, they because they had testing capacity limitations, they said we'll do preemptive isolation. So the moment you have a symptom, we'll assume that the person is infected, right? And that's again such a smart thing to do. And what we would do, to go back to the pond stuff, is that we will go systematically village by village, and we'll actually designate ponds, that these are the ponds which only the infected can use, and the other ponds will be used by the others. And by the way, if you're a village which has only one pond, then we'll make sure that in those areas, a particular stretch of the pond is called a ghat, right? And so we'll designate a ghat which is for the infected people, right? And the others can be used well. That is the kind of planning that they had. And by the way, as I said, they are on human development indicators, on their financial situation, much worse off than the first about. And naturally, given the state of our governance and our public systems, despite this plan, wide variation in the execution of this plan on the ground, despite that wide variation, if I were to sort of abstract the average effectiveness of the response of state 2 versus state 1, it is just dramatically different. And, I and you and I keep talking about this very often. I am not a great fan of, centralized planning and centralized direction, right? In the state of crisis, and given that your systems are underinvested in, it was what is required. And unfortunately, there are too many states which did sometimes, I would say, abominable job of it. Sometimes, not such an effective job. And there's some states which, at least in my assessment, have done a really good job. Numbers may not reflect it, because the numbers are eventually a product of so many other things.
Yeah, no, absolutely. In fact, in the peak of the second wave, I wrote a piece that drew on Land Pritchett's argument of a flailing state, where he argued that the head was strong and hands and feet had lost their connection with the limbs and weren't being able to perform. And I sort of said that the head, the central national government, in many cases state governments, had abdicated from responsibility that ought to have been theirs, and it's the odd district, the odd panchayat, occasionally the odd state municipality that was demonstrating what it takes to be able to actually get us out of be able to respond effectively to the pandemic. And what you're saying really reinforces that. And maybe going forward, we need to document these examples in with great care, because it is these best practices that probably will have the seeds of a state that is of what is needed to be done to genuinely strengthen the public health system in a way that the state can respond with both sensitivity and a sense of justice to the challenges of health and to the challenges of pandemics going forward. Anurag, I did want to sort of also talk to you about the economic deprivation and hunger that you saw on your travels, and we haven't over this last 2 months or 2.5 months of the second wave. It's the tragedies of the health aspects of the pandemic have dominated public discourse. And it's only now that the second wave is at least seemingly receding somewhat or abating somewhat that the economic distress is beginning to make its way into our public consciousness. But you did write about this in your recent piece in the Mint, and I was keen to ask you about this. We have a sense of how deep deprivation already was after the economic shocks of the first wave. And many surveys, including some done by the Azim Premji University and the Hunger Watch, told us both that people were now having to skip meals, the nutritional quality of food was reducing as a consequence of the economic distress. So clearly, the second wave comes on the back of significant shocks that families and households had to experience with the first wave. So one can only imagine that the distress was far sharper. Could you give us a sense of what you saw and experienced?
My sense is that we are underestimating, as we too often do, the economic distress that the so-called second wave has caused. Second is that in these weeks that I've been traveling, I've been through 29 districts. And in those 29 districts, I've forgotten the exact number of villages and towns that I have visited. I have it somewhere. I have every community that I've talked to, every, bar none, they have all survived the past year by borrowing. So one must look at not just the last 10, 12 weeks, but must look at the last 12 months. So if one were to look at the aggregate level of indebtedness of our households, and particularly vulnerable households, I would think, and I've seen that myself anecdotally, and perhaps the aggregate research numbers would tell us sometime later, indebtedness would have gone up many-fold, right? Many-fold. Now, naturally, if you're surviving through debt, even in February, January, it is constraining many things for you. And one can only fear what all is going to come over the next 24 months with most communities with this kind of indebtedness. Third is that, and for the third one, I'll give you two illustrations. One is a community where they are displaced mining workers, and they settle down, and the men have become mostly lorry drivers. And they're lorry drivers who are not in, let's call it, permanent employment of some lorry owner, but who get day by day lorry driving, and the women of the household are, as they are called, basically majdoors, right? So they go and do. Now, past 2 months, they've had absolutely no source of income. Absolutely no source of income, right? And I was curious because, if you are, and that particular habitation is about 8 kilometers, 9 kilometers away from a reasonably large city. So, you would have, my conjecture was you would have opportunities of various sorts to somehow, eke out a living, right? But the reality on the ground is that despite construction being allowed, it's come down to such a low level that if lorries are being used, they told me that if they're getting, I think the number that they told me, they will get 15 to 17 days of, lorry driving per month. Earlier, they were getting like 1 or 2 days. That's the drop that they have on the lorry driving side. On the Majuri side, they were just not getting anything at all, right? I'll take you to another community, another part of the country, and basically they tradition of being Lohars, right? And they continue to see themselves as a Lohar community, and therefore even today, what they mostly do is they do welding, and they'll do sheet metal work and stuff like that. That's what they do. And again, it's let's call it peri-urban sort of a community, right? Not exactly entirely rural. They also completely lost all opportunities. So whichever kind of situation I looked at, deeply rural or kind of peri-urban communities, I see a kind of livelihood crisis which is very akin, and because of the continuing nature of the crisis for the past year, much worse than last year. Last year, I think the great savior in the rural areas was the MNREGA scheme, right? And this time around, that is also gone, right? And that's gone partly because of some understandable reasons, because the states thought that large MNREGA sites will become sites for spreading the infection. But the reality is that has cut the only lifelines there for rural areas. Now, what does one see as the possibilities? In my assessment, and we'll see the numbers. Unfortunately, both of us know that indicators, whatever you do, indicators have a significant lag, right? I mean, human misery, human distress, human tragedy has long unfolded and gone by the time you see the numbers. But lastly, I must also mention that over the past 12 months, we've been privileged as we are with the endowment that we have. We've been supporting actually hundreds of other civil society organizations to basically deliver humanitarian aid, which is meals. In brief, meals. I mean, you can call it by any name. We've seen that rise staggeringly in the past 6 to 8 weeks. Staggeringly, absolutely, right? So if I were to tell you the numbers, I mean, I think I may be off by maybe 15 lakhs here, but between April to February, we had done, I think, 35 crore odd meals, right? 35 crore or 38 crore odd meals. And between April and May, that number has risen from the 38 odd crores to about 52 odd crores, right? So, so this is completely staggering, completely, absolutely staggering, the rise, right? So tells you that we are facing such a deep crisis that it's difficult to describe right now, at least for me.
Yeah. And added on to this is the crisis of schools being closed for a year and a half, presumably. I mean, the long-term consequences of that are significant, but, except in some states where some dry rations are being given to households, the absence of the midday meal also sort of adds to this, right? So not only are we going to see a sort of education crisis, a crisis of learning, but it's also probably layering on a new one more aspect to the nutritional crisis of hunger that we are confronting.
Yeah, true. Most states that I know of, from a procedural perspective, they've all mandated that this is the way the midday meals must be delivered. But the reality on the ground is very often very different. I mean, it's all right if you say, well, we can deliver the ration once in 15 days, but you do it with rigor. If you do that, then it's okay. But you say that and it happens once in 2.5 months' time, 3 months' time, then people can't remain hungry for 3 months, right?
Yeah, yeah. Anurag, in your latest article in the Mint, where you wrote about your experiences, what you learned through your travels, and gave us a glimpse into the realities, many of which we've spoken about today, you ended on a very pessimistic note. You said that the current respite is likely to be fleeting, and there is a crisis looming ahead, and we don't yet have a good enough handle on how to prepare for that crisis. Is your prognosis for what's going to happen in the next few months really as dark as that? Are there things that we can at least place in the public discourse to push our governments to do, so that we can avoid another near apocalypse, which I guess another round of this will probably take us to an apocalypse, not just near one? What are your thoughts on what we can do, if there's anything we can do at all?
So, Yamini, I think that given what we've been through in the past 2 odd months, given what we've been through, my advice, my own thinking about any decision making is to absolutely minimize the risks that you want to take. Absolutely minimize the risks. And therefore, in some senses, to overestimate the risks that are out there. I guess that's, if I may myself say so, that's the only wise thing to do, and for the country, right? And when there is enough and more that you can see on the ground, which suggests that there are very significant risks ahead, particularly if that's the situation, then you would actually take into account everything and more, and then act on that basis. And what I see on the ground, or have been seeing on the ground, is one, what I mentioned earlier to you, that we've got the second wave in quotes in control because of the lockdown. We've treated it as a law and order problem. You tell people to stay at home, they don't meet each other, and that's it. So of course the infection goes down. And when you open up, because you've treated it as a law and order problem, not because people understood and accepted, and on the basis that understanding and acceptance change their behavior, right? And that's hard, even if they understand and accept, which I think a large majority does, the seriousness of this issue, the infectivity of the virus, but you change behavior, and we know how hard behavioral change is. So we've not attempted to do that. We've not attempted to help in educating people, making people aware, not just about the infectivity, but about the kind of patterns of behavior and their consequences. We've not done that. So we've controlled the virus by basically putting people behind their closed doors. So open up. You're done with the lockdown. And when you're opening up, and even if when you're opening up gradually, you must expect there is no underlying change in behavior patterns. And then what does it tell you? What it tells you is that you will again release the pathways, the virus traveling from one person to the other, and one part of the village to the other, and so on and so forth. Right? And when that you combine with a second factor, which is that the fact is that despite the staggering the second wave, the sense on the ground is that not everybody, not every part, not every village, not every town is as infected. Which means even to the extent that infection provides you with short-term defenses against new infection, short-term defenses, and the science on that is still being, evidence is still being gathered. Even that defense is not available in large parts of this country. So now you've opened up your lockdowns. People will go back to their old patterns of behavior. There are large tracts of this country which are still not having whatever defense that early infection provides you, which means you have an open playing field for the virus. We are, we are way off from where we should have been on vaccinating our population. Way off. I mean, I don't remember the numbers from yet, but I guess we are maybe 3.74% of our total population is fully vaccinated, right? So, where are we? And so with this kind of a situation, the question then one needs to ask oneself, what should one prepare for? What should one fear? What are the risks ahead of us? And I think the prognosis must be therefore very bleak, because if your prognosis is then, in some senses rosy, then you'll not act. And the balance of risk here clearly lies towards, another very severe, if not near apocalyptic wave. And I'm not even going in the direction of that if you have such large populations, unvaccinated, you have this much more infection that might actually engulf the country, then how much more mutation will you have, and what effect does the muted virus have on any of the population-wide virus shields? So those are even more complicated issues. So yes, I'm very apprehensive about the future. Very apprehensive, and my apprehension is even more because I don't see the same degree of seriousness that I think should be there about this matter.
Our policy making frameworks
across the board, whether it's the policy making frameworks, or whether it's our media, or whether it's our civil society, whether it's just across the board.
It's already happening in a sense. The traumas of the wave are now feeling like they are behind us, and everybody's sort of moving on without reminding themselves that there's a lot that needs to change in order to avoid the ravages that we experienced, the horrors that we experienced the last time round. But Anurag, I can't end a conversation with you without talking to you about what is going to happen now going forward to education, to our schooling. We now are looking at, it's been already a year and 3 months, as you said, and probably looking at a longer gap. Is it time for us to start innovating with experiments to reopen schools? I know there is a fair amount of research that is now coming out from many countries that ensured that changed the organization of schools, so that schools were the last to close. Yet as a society, we seem to be quite comfortable with this prolonged closure of schools. And ironically, education only makes it to the front pages and to furious battles on television when it comes to decisions around examinations. And nobody is talking about what is going to happen to the future of our children.
Let me start with what I think is the reality and the only realistic, let's call it, approach or solution, right? Whenever you're able to open schools, and I'll come to that in a bit, whenever you're able to open the schools, let's get all our children to, in quotes, repeat this year or repeat the last year. If we don't do that, we are looking at a weakening and undermining of the basics of education of hundreds and millions of our children, which will not be recovered. So let's face the reality. If children don't go to school for a year and a half, whatever you do, you cannot compensate for that, right? And if you have any degree of honesty within yourself, and I'm talking about us as a society. I'm not talking, because this is not merely a issue of governance and politicians, right? If we as a society have any degree of honesty, we have to say, look, this is fine. Fine meaning our children will repeat a year, and that's okay, because that is what is the only way out of this really dark situation that we face, right? So I think that's first. There is no way of evading that issue. It is an unpalatable truth which people are too often not even willing to talk about. Forget about imagining how to implement. Is it, right? Second, I feel the opening up of schools is now in a very complicated. It's in landmine territory. I have argued earlier. I've argued in September last year through January this year that please open up schools. Please open up schools, because you can open up schools. Most village schools serve the same mohalla, same community. Anyway, those kids are mixing up, so therefore you're not increasing the risk. And I still believe that. However, what's created the landmine now? You imagine a situation where you open up schools, and given the size of our country and the vast number of our student population, and given that children are going to be the last in the priority to get vaccinated, and that's rightly so. There's nothing wrong with that. You are going to face a situation where it's likely that children will get infected. By the way, as every expert is now crying hoarse that there is no evidence to believe that the so-called third wave will strike children more. That's not true. That's just false. And that's not what I'm referring to. What I'm referring to is that when in a population, relatively speaking, children are let's say the only group that's unvaccinated, it's inevitable that they will have some infection, right? And with such a large number of children, when you have some infection, you may have some serious cases, right? And then you imagine the political reality of this country. So you can imagine this, this far-sighted, courageous education minister of any one state. I know a few of them at least. They have said, no, look, we will open schools because all science says we can do it, etc. And you think of it 3 months later, when something like this happens, what is going to happen, right? The entire political class, everybody's going to come down on like a ton of bricks on that person. They're going to shut down the schools. So on the opening up of schools, right? On the opening up of schools, I think what we need to do is that, one, we need to actually, first of all, vaccinate teachers at top priority. And not every state has done that, right? Second, thereafter, actually accelerate the trials on children vaccination, right? And we know all the issues with vaccine supply, but the moment vaccine supplies ease, we need to then get children vaccinated. Third is that once the teachers are vaccinated, then we actually need to go back and actually open the schools, right? And using the same kind of precautionary measures that we've talked about, you can hold the school outside. You can make sure that all teachers who, despite being vaccinated, are wearing masks, and so on and so forth. Use the usual precautions, but go ahead and open the schools. In the way I see the situation on the ground, even if one were to act in this manner, and even if every state were to have the, let's call it, the courage to do all this and the execution ability to do all this, this is going to take time. This will not happen in the next 4 weeks. My guess would be that if everything goes well, this itself is going to take between 3 to 4 to 5 months. And that's a bit of that is also about the fear of the second wave, right? I mean, who's going to open up schools with this kind of thing that's happened in the past 2 months? So in the next 3 to 4 to 5 months that we're talking about, and the earlier we can do all this, the better it is. But whatever period that might be, I think we need to go back and get the teachers to go and hold mohalla classes, right? There is no other solution. Our kids cannot do online education. It's ineffective anyhow. That's a different matter. But our kids cannot do online education. It's not work. Now it's so many months. You got to get the teachers back into neighborhoods and let them not open the entire school, but in some kind of a roster, go around in neighborhoods and hold mohalla classes. And as we've discussed before, some states have shown with with a lot of character, this can actually be done. And while it doesn't compensate for the entire loss of schooling, it certainly does a much better job of keeping children connected both to education and to the education system than online classes or some idea of giving them homework, right? So it's a complex, very complex reality, like anything else. Um, and I must say, I'm very worried, very, very worried. I mean, we keep saying that this is a unprecedented crisis, and it is an unprecedented crisis. It is an unprecedented crisis for education also, right?
In fact, the Azim Premji study that told us children have lost more than 70%, if I'm not wrong, children have lost language, they've lost basic mathematics skills that they had picked up. If it was across, I think, a fairly large 11,000 plus sample of students that the study was
16,000, yeah.
16,000, right, that the study was conducted on. So if that's one indicator of just how much has been lost due to the pandemic, and how little we as a society, I guess, we have made so many parts of our society invisible to the public discourse and to the political narrative that we build. We've now even further invisibilized our children and our schools, which we often trot out as the great demographic dividend. If you don't make any investments, there will be no dividend, and we are looking at what's going to be a very, very worrying scenario if we can't. Even now, we still have the opportunity to try and fix things rather than just letting them slide and dealing with the dire consequences that we will confront some years from now.
On that education matter, I want to emphasize again that there is no solution but to, in quotes, what's called repeating the year. We are being silly and escapist, and we are damaging the future of our children and our country if we think that there's another solution possible.
No, I completely agree with you. And in fact, that repeating of the year too will have to be done over maybe even a year and a half or two, because I'm that was open for children and teachers to readjust to each other. It's going to take time. And what about all those children who should have been in school, whose schooling life should have begun in this last year to year and a half? Who've not even who haven't had preschool. The fact that there is no foundation that has been built, they can't suddenly start, racing to meet curriculum level expectations at a time like this. So are these conversations going on in different states that you've been traveling on, at least at the amongst school leaders and educationists and government? Are we even beginning to think about what teaching and pedagogy should look like when schools open?
It was happening quite in February and in March, but I think in the past few weeks, people are so drowned in the tragedy and dealing with the situation that not much of it has happened. I'm beginning to see it again in the past couple of weeks, but I would say it's very inadequate right now. And a lot of it is still about how can we have a shortcut to somehow not repeat the year.
Well, Anurag, this means that we just have to call you back for a longer conversation on how to handle this big schooling challenge that we are confronting now. But till then, thank you so much for this really insightful conversation. You've been the eyes and ears for so many of us, telling us what's been unfolding across the country as as large parts of urban India stay in the comfort of their work from home lives. We need to know what's happening, and we need to have a better understanding of how grim things are, and how close we are to a next phase of a potential apocalypse. I hope we avoid that tragedy. But one way of doing so is by understanding and knowing and understanding what's happening across the country. So thank you so much for that. And really, it's been a privilege talking to you. Look forward to having you back.
Thank you, Yamini. Thank you so much. And I can only say Amen and Inshallah.
Thank you for listening. You can follow us on Twitter at CPR_India and on our website www.cprindia.org.